Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. I'm really glad you are joining us today because we have a powerful show. We start out with U.S. Representative Suzan DelBene to tell us what happened inside our nation's capital and what you can do about it. After that, we hear from an expert from Planned Parenthood giving the latest update there as well. We get some news of hope from North Carolina, and we close the show talking about a new activation on July 26th, where we need you to join us wherever you are. We're going to jump right in with our first guest. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We are so lucky, you all, to have with us today an actual real life superhero, a champion for all of us, a person who goes into the U.S. Capitol nearly every day and fights for us, and who is so effective in fighting for us. I want you to give a warm round of applause and welcome to U.S. Representative Suzan DelBene. Welcome, welcome, welcome.
Thank you. That's a great welcome. I really appreciate it.
One of the things that we sometimes hear is, all members of Congress are in the same boat, in the same bucket, doing the same things. That is not true. So you are one of many superheroes that are standing up for moms, dads, families, and our economy. And we've seen time after time the Democratic leadership standing up against ridiculously bad bills that Republican leaders and Donald Trump are pushing through. And one just went through and was signed into law on the most hypocritical day, July 4th, because it does the opposite of what we need to do for our country. And I'm wondering if you can share a little bit with our listeners about what they need to watch out for in that law, but also maybe some glimmers of hope of the champions in Congress like you who stood up for families. Because too often, again, we put everybody in the same boat who's in the US Capitol, and there are superheroes who are being overlooked. You among
Well,
them.
well, thank you for that. And first of all, uh, this is a terrible bill. It was a broken promise. People across the country have been asking for help with the cost of living, to lower the cost of living, whether it's housing, food, energy costs. And this bill does nothing to help working families. In fact, it raises costs across the board. Healthcare in particular, massive cuts to Medicaid, to the premium subsidies that help people who are buying their healthcare on exchanges across the country. 17 million people losing access to healthcare across the country because of this bill. I was just talking to a local food bank in my district about the cuts to nutrition programs, and even to things like that impact people who are on WIC, which is helping women, infants, and children, just the most basic things possible. It has been terrible to see that this is what's in this piece of legislation. And it's everyone. It's going to raise healthcare costs for everyone. It's going to raise and impact folks all across the country. And so this wasn't a partisan bill, even though it turned out that way. Everybody's communities are impacted, and your stories, and so many people throughout your network shared their stories about how it was going to impact their families. And just thank you for that, because that's what we need to talk about, is kind of the real impact this legislation will have on the ground in our communities. And we need to continue to highlight that so we can do everything possible to get us on a better path.
And we were watching the vote, and we saw that every single Democrat voted against this ridiculous bill and stood up together strongly and read our stories, you all. Read our stories on the floor of the House and the Senate. We saw in the Magic Minute, where we had U.S. Representative Jeffries, who's the House Minority Leader, when he took that very long Magic Minute. It's called a Magic Minute because it lasts for way more than a minute. It lasts for as long as the person can talk. And he himself read a ton of stories from Moms Rising members. So your stories matter. And then we've also heard, we did so much work with Senator Tillis, who is a Republican who did the right thing, one of the only Republicans who did the right thing in the Senate, that it was the stories of moms who actually got him to change his vote. So I just want to take a moment with our listeners, with our audience, with everybody, to say thank you to every single Democrat who stood up together without losing a single vote against this disastrous bill. And now I want to dive into the disaster. So WIC, SNAP, all of those programs, we know, don't just help families and open opportunities for people to thrive, they also boost the economy. So this bill is undermining our economy in such significant ways. I'm wondering if you could dive into that a little bit, Representative DelBene, about how it's not only hurting families, the pieces of policy in this bill, but also our economy as a whole.
Absolutely. Well, first, let's take, you're just talking about SNAP and nutrition programs. For every dollar that's invested in SNAP, we get $1.80 of economic activity um, throughout our region, throughout the country. And part of that is because when people have healthy, nutritious food, they do better. They're able to give back more to the local economy. That helps our farmers. So also a big impact to our agricultural community. So we see those dividends in terms of people being able to participate in the workforce, kids doing better in school. I mean, one of the things that comes from these cuts is cuts to free school lunches. For a lot of kids, these are, one place where they get a full meal every day. You cut that and, when kids are hungry, it's really hard to pay attention in school and to do well. When we invest in our kids, they grow up better, they grow up healthier, they get a better education, and that has long-term impacts. So there's the short-term impacts, there's the long-term impacts on our communities and our economy. And then let's put healthcare on top of that. These devastating cuts to healthcare mean that people are using the ER to access healthcare for primary care. That raises costs for everyone in healthcare. Rural hospitals have talked about how they would have to close. They can't stay open with these cuts. Many jobs. Talk about all the folks who are working at these hospitals and then how overwhelmed folks are at other health institutions who are trying to keep up with to meet the demand from all the closures that we see. That has a huge economic impact. And, in some of our communities, those hospitals might be one of the biggest employers, and they're closing. That is devastating across the board, not just to folks in the community, but in the surrounding area. So all of these things have long-term impacts, and for no reason, only to give tax breaks to the wealthiest in our country.
I love that you brought up the for no reason, because sometimes people are like, well, maybe we can't afford it. I'm like, actually, we can afford it. The amount of tax breaks that we just gave to people who are already very wealthy, who do not actually need more tax breaks, exceeded the costs that were cut out of healthcare. So we could just reverse those additional tax breaks and be fine. Thank you very much. So hello, Republican leadership, please reverse immediately. Just sending a message out there to the Republican leadership.
Well, and these investments save us money. When people are doing better, our communities are getting together, our economy's stronger. Not only does it save us money, but our quality of life, families are doing better. So this idea that somehow slashing nutrition programs, slashing Medicaid somehow is saving, absolutely not. It is costing us a lot. It's costing us in terms of dollars into our economy, but it's also costing our families access to healthcare and healthy, nutritious food. And
And
again, good point, for no reason.
yeah, for no reason. And it's costing lives. So going into this, we already were the only industrialized nation with maternal mortality, or people dying in childbirth, going up, not down, and with Black women dying 3 times as often as white women, which is not okay. We do not want people dying in childbirth. We do not want the situation that we have. To go into this budget reconciliation discussion with Republican leaders and Donald Trump and have them come out with taking away Medicaid, of all things. Medicaid covers, or is part of, 40% of all births in America. It's part of more than 60% of people in nursing homes. It's part of 1 in 3 people with disabilities being able to live their lives. And to have Medicaid be the thing that Republican leaders decide to pull the rug out of under American families is just jaw-droppingly awful, because frankly, we weren't doing all that well going into this conversation in terms of where we are in terms of equitable access to healthcare. So we are going to not only lose dollars, not only hurt our economy, but more lives are going to be lost. And I'm wondering if you want to speak to that too.
No, you said it incredibly well. It means people don't have access to healthcare. Rural hospitals close. It means folks have a longer and longer a drive to get to
Yeah.
healthcare. It means labor and delivery closes in a lot of our rural communities. Those will be some of the first pieces to go because they're expensive. And anyone who has an emergency need, it'll be harder to get there in time. That impacts lives. Again, for no reason, when we make these investments, we help communities. So we are going to make it harder and more expensive for everyone. Some folks will lose their healthcare coverage altogether, and we know how devastating that is. People get sicker. By the time they see a doctor, it's after they're very sick. They don't have access to primary care anymore. None of the things that actually save us money and put us on a better path. So it is hard to come up with any rationale of why any of this makes sense. And that's what's so disappointing. This isn't an issue that impacts just one part of the country versus another. I think the reason you saw and heard this outcry from across the country is because people know this is going to impact us in every corner of the country, families all over in urban and rural communities. Um, and we should be making long-term investments that help uplift our communities, and we can. And to your point, instead of moving in that direction to try to make things better, we are absolutely going backwards. And it's heartbreaking to see, and why it's even more important now that folks continue to share their stories and be engaged and involved, because we have to continue to fight this path that we're on and move to a place where we can start actually again investing in our future.
You used the word heartbreaking, which is one that I share in describing what just happened. And in that heartbreak, where are you finding hope to keep fighting, to keep pushing, to persisting, to fix this great wrong that just happened to America because of Trump's ridiculously bad policies and his Republican leadership following him right off a cliff?
And not standing up for their communities. We need people to stand up for communities. And the way we make that difference is we hear from people in our communities. And that's why voices are so important. That's why people sharing their stories, sometimes very courageously sharing their stories, makes a difference. It's important for everyone to know what this means to our community, what it means to our neighbors, to our family, and to continue to stand up. I know that public sentiment can have a big impact. It has a big impact on legislators understanding and standing up for their communities, and it has a big impact on policy going forward. So we all have a role to play in standing up, in sharing our stories, and making sure the American people know the devastating impacts coming from this bill and are speaking loudly against it. And frankly, more and more people have learned about this bill, the more and more the public is against it. We need to continue to use our voices so that we can change unfortunately what just went into place, as you said, on July 4th.
Do you rely on any touch points in history to keep you going with hope moving forward?
I think a lot about where people stood up. And as you know, I was born in Selma, Alabama, and a lot happened at the civil rights movement in Selma, Alabama. People stood up to fight for their communities, to fight for their neighbors, to fight for our voting rights for every single one of us. And they didn't know that. They knew it wasn't going to be easy, but they stood up because it was so important. And I think we all have that role to play in our communities, to stand up, to realize that we need to be strong, make sure our voices are heard, and that we're working together to make a difference. That's how great things have happened in the past, and why I think, and I am inspired hearing what I hear from people across the country, that we can do that again.
100%. I agree. We can do it again. There's a whole bunch of activations coming up, listeners. We have a July 17th activation coming up. There's a July 26th activation coming up. There are so many activations, and that gives me so much hope that the people are persisting, that people know that what happened due to Donald Trump and Republican leadership in Congress, that is wrong for our country. And people know that in red, blue, purple, green, any color kind of states we have. We are seeing polling that nobody agrees once they find out, as you said, what's in the bill. Nobody agrees with what happened. And so thank you, everyone, for taking action and not giving up. And a huge thank you to U.S. Representative DelBene for standing up for us inside the US Capitol and not giving up. Thank you so much for being on today.
Thank you. Thanks, everyone.
We're going to take a quick break, but stick around. We'll be right back with our next guest telling us what's happening with Planned Parenthood and what you can do about it to help. We'll be back in a quick flash. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We have a very, very important guest for you right now who has some breaking news and information that everyone should know. Shireen Gorbani, who is with Planned Parenthood Association of Utah. Welcome, Shireen.
Thank you. Thank you. It's so nice to be with you.
I'm so thankful that you're here because Planned Parenthood has been ridiculously under attack by Republican leaders and by Donald Trump for far too long. And also recently, I have to say, I have a great love affair with Planned Parenthood. Multiple generations of my family have actually supported and worked with Planned Parenthood. And we know that I believe it's 1 in 3 women in America have had some type of health care through Planned Parenthood. So thank you. You at Planned Parenthood on behalf of multiple generations and 1 in 3 women in America and basically everybody in our country. And also, can you share a little bit about what's happening with the attacks right now so people know what's happening and how to fight back?
Yeah, I'm happy to. So, first of all, thank you so much. And you are right. Planned Parenthood across this nation has really been the experts in sexual and reproductive health care for millions of women and for generations, as you have mentioned, really making sure that people from all walks of life, from all backgrounds, are getting the information, the education, the health care that they need, and of course, the advocacy as well. So, right now, what has happened is in the budget reconciliation bill, there was a provision that was a blatant targeted attack on Planned Parenthood and Planned Parenthood patients. And I really need listeners to understand that when politicians want to talk about going after Planned Parenthood, what they are going after are patients being able to access essential health care. We are talking about access to birth control, STI testing and treatment, cancer screenings, making sure that people get the basic care that they need to control their lives, their bodies, their futures, to plan their families when they're ready to, all of those essential forms of healthcare. And the patients that utilize them, that's who's under attack here. That is who is losing out with this budget reconciliation. So what happened is when the law was signed into effect on the 4th of July, people's freedom to choose if they have Medicaid as their insurer, their choice to go to a Planned Parenthood was immediately limited. Now, I need also newsflash, an important piece of this. At this point, we have, along with Planned Parenthood Federation of America and Planned Parenthood League of Massachusetts, filed in court to challenge this illegal behavior, and we were granted a temporary restraining order. So the landscape is different. There are already states that have prohibited Planned Parenthoods from being able to accept Medicaid. So it's really important that you check in your local location to see what's going on. But in many places, for Medicaid patients, access to Planned Parenthood has been temporarily, for now, restored. So we are incredibly proud of the efforts that we are taking to ensure that people have the freedom to access care where they want to get it.
And that is so important. But the unfortunate part is it's a fight. So let's talk about how many people are getting health care through Planned Parenthood. And I think this is really, really, really important. When you talk to your friends, your family, your neighbor about what's really going on in your life, you pretty much hear everybody has gone to Planned Parenthood for some type of health care at some point in their life. It's really an area of universal health care. And often Planned Parenthood is in places that are healthcare deserts. And I bring this up because right now in that same budget reconciliation package that just passed, there was a rollback of at least 17 million people getting cut off of healthcare, looking like we're getting at least 300 rural hospitals closed. And we're also hearing that hospitals of all sizes, especially places like Trauma One hospitals, are going to have to either significantly roll back or some even shut down across the country as well. It's devastating.
Yes.
And through it all, we have Planned Parenthood is actually quite well distributed across the country as a place that many people get a lot of healthcare services. So I'm wondering if you could speak to both the impact in terms of healthcare deserts of Planned Parenthood being shut down, and also the wide array of healthcare services that Planned Parenthood provides, which many people, if they don't go there themselves, don't realize.
Yeah. So I think I want to make this even a little bit more high level. So to be crystal clear, what happened with this budget reconciliation bill is Trump and the backers of this administration in Congress were perfectly fine throwing Planned Parenthood patients out of their healthcare with a place that they, normally go to receive the healthcare that they want. They're perfectly fine with cancers going undetected, with STIs going untreated, with people unable to access the birth control or abortion care that they need. And they were willing to do that to Planned Parenthood patients immediately. The rollbacks, the people losing healthcare, the threats to Medicaid that we're talking about, those are not set to go into effect until after the midterms, because we know everyone understands how politically damaging it is to make people's healthcare costs greater, to make it more difficult to access healthcare in this country. But that is exactly what they have done. And they were happy to put patients who seek care at Planned Parenthood at the front lines of that they were willing to strip away their care and their rights immediately. So I think we should all be very concerned about that. But that is actually a second tier to what they've been doing, which is Title X cuts that already came. There's been significant withholding of Title X funding across this entire nation. There are now a handful of states, I think it's 7 states, that have no Title X funds. And what that is the only domestically funded family planning program in this entire nation. So people in Utah, for example, relied on Planned Parenthood to have access to low or no cost family planning services. Again, we're talking about access to birth control, cancer screening, vasectomy, STI testing and treatment, the basics, right? That has already been put those resources have already been stripped away from Utahns and from many other Americans. So that already happened. And we're seeing cuts to community health centers. We're seeing significant decreases in funding and support to county health departments that are often also a backstop when it comes to STI testing, treatment, and tracking. So this is an unraveling of our public health infrastructure. Planned Parenthood is a proud piece of that puzzle to make sure people get the care that they need. I live here in Utah in a state that has many areas where it's difficult to access healthcare. In some cases, a very urban state. A lot of us live together, but we have people in far-flung areas that don't have a lot of infrastructure. We're proud to be able to offer care through telehealth services to try to reach people where they are. We're working very hard to make sure that Utahns all over this state, and just like Planned Parenthoods are across this entire nation, to make sure that people have the information, the care, and access where they need it. So the attacks really are just, I think, the tip of the iceberg for what this administration is trying to do.
Yeah, undermining access to healthcare for everyone.
Yeah.
Just want to say that for people of all ages, for people of all stages in life. And they're doing this in a moment. It's just so awful when the United States of America has one of the highest maternal mortality rates of any country that is industrialized on the planet Earth. And we are the only World Health Organization country where maternal deaths are going up, not down, and Black women are dying 3 times as often as white women. So in the middle of a maternal health emergency, we are having Republicans and Donald Trump rip away even more access to health care that would literally save lives. So
Yes.
this policy that is being pushed through that limits our ability to choose if, when, and how many children we're going to have, as well as to get that care that you just mentioned for cancer treatment, for UTIs, for all kinds of different health care that we need in order to be able to choose if, when, and how many children we're going to have, is being ripped away in such a hypocritical fashion.
Yeah.
It's really so hypocritical. What can people do?
Yeah, so there's so much that people can do. I would say first, if this is an issue that you care deeply about and you're upset that your member of Congress did not vote the way that you wanted, it is really important to call members of Congress, especially in red states, in red districts, and let them know that you support Planned Parenthood and you support access to sexual and reproductive health care across this entire nation. When I do lobby, I sometimes hear from our Republican representatives that they never hear from us. So take that time, make that phone call, make sure that your representatives in the federal government understand that you live in their district and you support access to care and that you support Planned Parenthood. Another thing that you can do that's something that, is we understand with all of the threats that are going on. I completely understand with the destabilization that people are experiencing across this economy. It's hard to ask, but I'm telling you, if you are not supporting Planned Parenthood now and you have the ability to do so, find your local member. So if you're in Utah, of course, we'd love to have your support at Planned Parenthood Association of Utah, but go find your local organization and start making those monthly donations. Even small dollars can really go a long way to help sustain this essential part of healthcare across this country. So ongoing donations to affiliates, to Planned Parenthood are really important. Then we also have the piece of getting involved. Every program, every organization like this that I know of has a way for you to volunteer. That might be as a patient greeter, that might be tabling out in communities, spreading the word, but you can also do kind of small acts of volunteerism by sharing information on your own social media, across your own platforms, making sure that your friends know that Planned Parenthood accepts major forms of insurance. People are looking to get an IUD, or they're, looking for their wellness exam. You can go, you can take your dollars to a Planned Parenthood, and all of that matters. Every single action matters in this moment.
And I also want to talk about access to abortion care. So
Yes.
people assume that that is the majority of what Planned Parenthood does. It is not the majority of what Planned Parenthood does, but everybody needs access to abortion care across the country. And
That's
I want
right.
to share with our listeners that 6 out of 10 people who need and have access to abortion care are already moms. So this is a very big mom issue. And not only is it a mom issue, it's a people issue. And people across the United States of America pretty universally support access to abortion care when you ask people in polling. And then people say, maybe the polling's wrong. Well, to that we say we have receipts. Everywhere that abortion has gone on the ballot, in red states, blue states, purple states, everywhere, we have seen victories of either protecting access to abortion care or expanding access to abortion care. Even in Florida, where the access to abortion care ballot measure actually lost because they have a 60% threshold in order to have any ballot measure pass, access to abortion care in Florida got more votes than Donald Trump. So when you look underneath what's going on in America, you see that we have a very, 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 very loud minority of people who are saying America wants this. Well, America does not want this. We want access to health care. We want access to the full suite of reproductive health care. We want access to abortion care. We want our decisions to be between ourselves, our faith, and our doctor, not between politicians. They have no place in a doctor's office. I feel strongly about this. Because our story after story of lives lost because we do not have sufficient access to our own reproductive decisions, our own bodily autonomy. So I have to have a moment where I jump up and down and my hair lights on fire about this. And I want to encourage everybody, no matter where you live, red, purple, blue, green state, contact your member of Congress and either thank them for doing the right thing and remind them that the majority of people in America are behind them, or remind them that they need to do the right thing for their constituents and that they're out of step with their constituents if they're opposing access to Planned Parenthood. And so I don't know if you want to add anything to my tirade in the end, but it is so upsetting, the degree of hypocrisy and how people are pulling away our freedoms to make decisions about our bodies, our families, our lives. And so back to you, Shereen.
Okay, so I mean, I would just say preach. We absolutely stand strongly on in alignment with what you've said here. What we understand is that when people are asked, even in a conservative state like ours, is access to abortion care a decision that you would make for someone else? The question becomes much more complicated. Though they may, and I certainly understand that people have strong personal feelings and may say they don't support access to abortions, they think abortions are wrong. People are entitled to that. But when you actually ask them, do you believe that this is a decision that you would make for your neighbor, for your friend, for somebody that you've never met? It becomes much more complicated. We understand this is essential healthcare and people need access to it.
Yeah, absolutely. So, listeners, we have 12 seconds left. Here is what we're going to say. Don't give up on me, you, or us. It is persistence across generations that brings us the freedom we need to make decisions about our own body and have access to healthcare. So please, please, please support Planned Parenthood wherever you are locally. Support the National Planned Parenthood. Please stay involved. And please, please do not give up. Thank you. And thanks for being on, Shireen.
Thank you.
We're going to take a quick break, but stick around. Next up, we're hearing about some moments of hope in North Carolina and how you can create hope where you are too. We'll be back in a minute. Welcome back to Breaking Through with me, Kristen Ralph Finkbeiner, powered by Moms Rising. We have a spectacular, inspiring, powerful guest coming on with us right now, Beth Messersmith of Moms Rising, who is leading the way nationally and in North Carolina. Welcome, Beth.
Thanks for having me.
I'm so excited that you're on because a lot of people think North Carolina, purple state, don't know which direction it's going to go. But your advocacy, the local organizing that you're doing has really made an incredible difference, including in polling Republican leaders to vote for the people of North Carolina instead of lockstep with Donald Trump. Recently, we saw Senator Tillis, who is a Republican, be one of the only Republicans who actually stood up against the Reconciliation Act because of the harm it would do to North Carolina's economy and families. And I'm wondering if you could just, as a way to spread a tiny bit of hope in really hard times, share, the sort of timeline of engagement with Senator Tillis and how the change came over time from moms speaking out, reaching out, and not giving up.
Sure. We have been working with Senator Tillis for almost a decade now, from back when he was a state lawmaker, Speaker of the North Carolina House. We've been going to his office. Moms have been visiting him, talking to him, delivering storybooks, sharing our personal stories, going to his federal office, really lifting up what the impact the decisions that he would made in Raleigh and now in DC actually have on North Carolinians back at home. In these last weeks building up to the vote, North Carolinians all across the state at all of Senator Tillis's offices, Moms Rising joined in partnership with the Health Action NC Coalition to host vigils all across the state, lifting out, speaking out, having providers, having folks who are Medicaid recipients who are benefited from Medicaid expansion, really coming out and lifting up their stories. And obviously it got through. Political courage is in short supplies these days, and it was such a huge bright spot to actually see it make a difference.
Yeah, and this difference, well, first I want to say what you said. Obviously, the messages from moms, from dads, from parents, and people got through to Senator Tillis's office. For a lot of people, it's not obvious that what they're doing is making a difference. And so it's such a good moment to say, listen, what you're doing, not just now, but over the years, adds up to educate, engage, and bring members of Congress of all political parties along. And we have evidence. We have evidence in North Carolina. We have evidence across the country, but this is a great case study. So speaking of case studies, I wanted to see if you would feel comfortable sharing a little bit about also some other wins in North Carolina that have really been seen as against all odds wins, because North Carolina is again seen as a purple state. So do you have other glimmers of hope that you can share?
We do. We've actually had a lot of victories. North Carolina, a lot of things happen in North Carolina incrementally. We may not make big, huge changes all at once, but bit by bit, by people continuing to engage over many years, we win huge victories. So, Senator Tillis voted the way he did because we know that the big, beautiful bill, the big betrayal bill, will actually mean that 600,000 North Carolinians who just benefited from Medicaid expansion will lose their health coverage. And Medicaid expansion was one of those wins. It took 10 years to get us here. So many people telling their stories, but we finally got there. North Carolina was also one of the first Southern states to provide paid family leave, paid parental leave for state employees. We did that by winning almost 24 local victories, getting cities, towns, school boards to pass paid leave policies. And those all added up so that eventually we got an executive order. We got a piece of legislation through the General Assembly. So now all of our state employees have either 8 weeks if you give birth or 4 weeks if you're the non-birth giving parent to be there for those important moments. We've had some major victories on childcare. this past year. When federal dollars ended, we worked successfully telling the stories of folks about how childcare matters to their families, how it helps them hold everything together. And we won significant investments to keep workforce compensation up for the childcare workforce. So even in states where the odds are against you, when people lift up their voices, tell their stories, put faces on the numbers, we can still win.
That is what is so important, the we can still win part, because there's a lot of people going, oh, there's no hope. Again, I know I said that before, but we are here to be the myth busters. There is still hope. And places like North Carolina really show that hope in motion is what matters. So it's not just like hope, okay, I'm not going to do anything. It's hope. Please keep raising your voice. Please keep making those calls. Please keep sharing your story. Please keep reaching out to members of Congress and educating them about what's really happening with real families. So for listeners out there who are in places that they're feeling hopeless, what tactics and tips do you have for what do you think works the best in terms of helping educate leaders to be on the side of families and the economy?
I think for so many people, the legislature feels so far away. It feels like something, talking to your lawmaker may not be something you're used to doing on a regular basis. But state lawmakers in particular are folks you can get to know, you can build a relationship with. When you pick up the phone and you call your state lawmaker and you share your story, you're starting to build a relationship that's not just for one time, but like as in the case of Senator Tillis, it may span a decade or more. And even if you don't live near your capital, we have folks 5 hours on each side away from Raleigh here in North Carolina, all the way in the mountains and all the way on the coast. You may not be able to get to your state capital easily, but your lawmakers come home. And there are opportunities to meet with them when they're in your district. Invite them, if you have a child in childcare, to come to your childcare center with you. See why it matters. Ask them for coffee. And realize that they do have a responsibility to hear your voice. What I was most moved by with Senator Tillis was he was very specifically calling out the 600,000 people whose stories he had heard over and over again here in North Carolina who needed Medicaid expansion. And he ultimately connected it back to his own story of growing up in a mobile trailer, in a mobile home, and how this would have made a huge difference to his family when he was growing up. And I think being able to make that person-to-person connection and really being authentic and building a relationship over time makes a big difference.
It's so important. And I love that you mentioned that Senator Tillis shared his own story about needing Medicaid, about how he grew up. And we see time and time again, people say, oh, my story doesn't matter. And it matters so much. So people, your stories do three things. One, they educate leaders and make those connections with leaders who often are not knowledgeable about what's happening with real families. Two, they educate reporters so we can help shift the narrative. And three, they help us know that we're not alone, because you see a pattern in the stories. A lot of us are experiencing the same things at the same time. So that means it's not an epidemic of personal failures, but it's a structural solution that we can solve together. And so those three things are really, 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 really powerful. It turns out when combined, and it can end up in flipping the way a U.S. senator is voting, like Senator Tillis, who's a Republican, flipped and voted against Trump's ridiculously bad reconciliation package and shared his story, as Beth just shared. What other moments have you seen the power of story sharing in? And double question, how can people who are listening best share their stories?
Oh, I mean, stories have made a huge difference all across, all of the work that we've done here. I mean, particularly when we talk about Medicaid expansion in North Carolina, stories were being read on the floor of the General Assembly in the debate, trying to convince people to vote the right way. When we were doing paid leave stories, people went to local city and county commissioner meetings and shared their story with local county commissioners. And then those people went and shared their own personal stories with state government employees, with human resources people. So when you share your story, it makes someone else feel brave enough to share theirs. And that can have a ripple effect, far beyond your initial story. And so I think that there's, right now we are working with parents and childcare providers to tell the story about why we need to be lifting subsidy rates here in our state. We're in the middle of a tough budget fight, and those stories make a tremendous difference. Yeah, and I believe that's why we will win.
You'll win? I love that. And we're probably going to win because of the stories. So how, like, what are the best ways for people to submit their stories, share their stories, yell their stories from the rooftops, be heard in their stories? What are the best ways to do that? So I hope people who are listening are inspired.
So there are lots of great ways to share your story. You know, sometimes it's easier to write it out. I'm a person who sometimes likes to sit and think about what I want to say, think about how I want to share my story. Moms Rising has lots of opportunities for you to do that through our story collection pages. On our website, you can submit your stories, and you can decide. You have control over how you want it to be shared, how you want to be identified. You get to decide all of that. We also have some great tools now where if sitting down and writing things out and you're much more comfortable just recording on your phone, we have opportunities for you to do that too and share your story via video. With social media the way it is these days, those videos make a tremendous difference. And we're trying to collect some of those right now here in North Carolina so that we can take the voices of folks all the way out in the mountains and all the way out on the coast back to Raleigh with us, and put a face for those lawmakers from those districts. So there are lots of different ways you can share your story. You can also team up with a friend and record each other. Sometimes you can interview each other. There are lots of different ways because we're all comfortable in different ways. But whatever way you're willing to tell your story, Moms Rising wants to hear it. And we want to work with you to make sure that we amplify your voice because you're the expert in what you're experiencing in your life.
And we're going to ask all our guests this question today, but what's giving you hope in this moment where the headlines are so bleak?
I will tell you that when Senator Hillis voted no in a really dark moment, it gave me hope and courage because, like I said, political courage is in short supply these days. But when it shows up, it deserves to be recognized, acknowledged, celebrated, because someone else may not speak up in this moment, but they may be inspired to speak up and do the right thing the next time. And I really believe that when each of us takes the moment, we stand up, we use our outside voices, we act with courage, we inspire other people to do the same thing.
It's so true. And also, it doesn't have to be sad when you take action or angry. MRI studies of the brain show that actually humor is one of the best ways to break through the partisan divide and get people back into their logical thinking as a community across different parties together. And so I want to share that because sometimes the headlines are so heavy and people can assume, okay, well, we have to be heavy and sad and only angry too, but we can come together with joy and silliness and make strategic differences as well. And I wondered if you had a thought on that to share, Beth, because we are in this really, really hard moment in history.
Yes, I think it does. It breaks through. One of the, I think it might even still be on the Moms Rising website. There was a story that I shared about when my son was very little and I took him to the legislature with me and he lost his favorite monster truck in one of the big fountains at the legislature. And he was 2 and it was his favorite monster truck. So I had no choice but to roll my pants up and wade into the fountain. And all of the lawmakers came out to watch while I waded into the fountain. But it is still like, it's still an icebreaker. We all have those moments. We all have children in our lives that we care about, children we would do anything for, even if it's like wading through the fountain at the legislature. And it's funny, but like that builds bridges with lawmakers who may not otherwise really want to talk to me, but who have grandkids in their own lives that they would have waded through that fountain for, right? Or children in their own lives. So I think that when we focus on the kinds of things that can bring us together across partisan lines, that remind us of the people we love and care about and why we all want to do this work, it makes a difference.
100%. And there's also another famous story of there was a person who had 2 toddlers inside a representative's office talking about the need for paid family medical leave. They were kind of ignoring them. And then there was a spill of water combined with a potty emergency by toddlers. It was the most human, ridiculously, hilariously disastrous moment. And we got that vote. So I guess this message for all of our listeners is that when you are doing advocacy, it's okay to be you. In fact, really, please be you. What we need to bring is a reality check to leaders who are often out of touch. You know, the people in office right now don't necessarily certainly don't reflect who we are as a country in terms of our population. We definitely don't have political parity. So bringing all that you are, bringing your story, bringing your kids, bringing your potty emergencies to and your monster truck emergencies to the halls of leaders is actually effective too. So thank you so much for being on, Beth. Thank you for all you do. Thank you.
You take care.
We're going to take a quick break, but don't go away. Next up, we are talking about an activation that we want you to join us in on July 26th. Find out all the details about how you can join and be effective in just a moment. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We are joined by a nation-lifting, world-changing, visionary leader who is a guest with us right now, Ai-jen Poo of the National Domestic Workers Alliance, of Caring Across Generations, of many awards, of authoring many books, of doing all the things. I can't even tell you how much proactive, positive, effective work Ai-jen Poo does every single day. So welcome, Ai-jen.
Thank you. Great to be with you, Kristen.
I'm so glad you're here, but we are going to talk about a topic, listeners, get ready, that is so deeply frustrating, that brings up so much anger and often can spark a feeling of loneliness. And so we are here to do two things. We're here to tell you about a disaster that is falling across America. It's truly a disaster. And then we're here to welcome you in to doing something in community that can happen with joy, that can happen with hope, that can happen to create change to reverse the disaster we're about to talk to you about. So I just had to tell people we have a solution. We're going to talk about the disaster first, but hang on with us because we're going to talk about a solution too. So Ai-jen, can you share a little bit about the absolute disaster? I mean, really, if there was like a term that was better than disaster, I don't know it, that Donald Trump and Republican leaders just pushed through our U.S. Congress and signed into law on July 4th of all insulting days. What happened?
A massive, massive bill that will have impacts on our economy and our lives for a generation at least was passed sneakily before a long weekend that will kick 17 million people off of healthcare, will close hundreds of hospitals and nursing homes, especially in rural communities where there's already really little infrastructure for people to get access to healthcare and family care. It will basically gut our healthcare system and also raise costs. So you're going to start to feel, I know if you're like me, you're out there being like, everything is so expensive. Just to have a family right now and take care of our families, it just by the day feels more and more difficult to make ends meet and make the math. Well, our costs are going to go up as a result of this bill. And you might have heard a bit about cuts to Medicaid. Well, Medicaid is this program that has so many sweeping impacts on our lives, on our healthcare, on our long-term care, on our workforce. Just one piece of it is that Medicaid is the primary source of funding for direct care workers. So if you've ever had someone in your life who worked as a nursing home worker, assisted living worker, and certified nurse's aide or assistant, a home care worker, personal care aide, that whole group of workers who care for older people and people with disabilities in our lives, they're called direct care workers, and Medicaid is the main source of funding for their wages. And many of them will lose their jobs. Now, because Medicaid as a program has already been so underfunded, most direct care workers have to rely on some form of public assistance just to get by. So they rely on Medicaid for their health care often. They also rely on SNAP for food assistance, and SNAP also got cut. So you've got a whole group of workers who we're counting on to care for our parents and our grandparents and our loved ones who are disabled, who might lose their jobs, might lose their health care, and might lose their food assistance. So this is, and that's just one group, but really I can't overstate how we're all going to be affected, because the cost of this big hole in our state budgets is going to be shifted onto all of us. We're basically shifting all of the risk that comes with being having a family in America in 2025 away from this kind of shared commitment that we made to having a safety net in place and onto individuals who are already really struggling under the cost of living in this country. And I'm terrified. And the worst part about it is that they're doing all these cuts, moving all this risk onto our shoulders in order to give massive tax cuts to wealthy, ultra wealthy people, and to fund human rights abuses against immigrant families, our immigrant neighbors, co-workers, friends, caregivers. I mean, it's being used to supercharge this machine that has been disappearing immigrants with no due process. And it's terrifying. So the kind of levels and layers of what is bad and what is about to unfold that is terrifying is really a lot to unpack, Kristen. And I just want to say this to the families out there who are concerned. Please know that Kristen and I, and literally thousands of us, fought really hard to prevent this bill from getting passed. We are not going to stop fighting. We may have not been successful in this battle, but we are determined in the long term to not only protect our safety net and protect all of our families, our immigrant families, our non-immigrant family, everybody, to make life better in this country, but we're going to actually make sure that we build a safety net in this country that helps us take care of each other in a real way. Not what we had before, way better. And the only way we do that is if we come together. And that's why the next thing that me and Kristen are working on is a big, big family day on July 26th, where people all over this country, families, you and me and our families, however we define family, we're all going to come together and show up for each other and remind each other that we are not alone and that we are in this together and we're going to keep fighting together. And the power of that cannot be taken away.
150%. So, everybody, July 26th, it is a Saturday. No matter where you are, we'd like you to join us in raising your voice and shouting out that we are still here and we're here for each other, and shouting out that we will not let these cuts to our healthcare, to SNAP, to our education, to our communities stand, that we will stand up and persist for a reversal to the damage that has happened. And we have hope, you all. We were talking about, we all fought really hard against the disastrous reconciliation package that just went through and was ridiculously again signed into law on July 4th. Well, the votes were much closer than many people thought they were going to be. They were so close that at one point we had to have the vice president do a tie-breaking vote, and they were within just tiny bits of votes of each other and the other body. They were close votes. And without us raising our voices, those could have been landslide votes. So we did make a difference in slowing down the package and in garnering more votes. And we need to make a difference in now reversing the package. And we know we can do it. And so Saturday, July 26th, we're coming together in groups of 2 people, in groups of 200 people, in groups of 2,000 people, in groups of you and your 2 cats. You can figure out the size of your group, but the idea is to all put our mark on the map, showing that we're here, we're persisting, and we're not giving up. And Ijen, how can people sign up?
You can go to the website that is, the event is called Families First, which, by the way, is exactly what we need to say to everyone. Our families come first. And so the website is Families First. Ooh, we're gonna have to check.
We're checking ourselves, people. We're checking in real time. It just went up. So, listeners, here is the exciting news for you. You are among the first to hear about the Families First experience that's happening. And we are very excited. It is familiesfirstnow.org. So
Okay.
familiesfirstnow.org. And we mean it. Families First Now. We do not want billionaires first. We do not want harm to immigrant families that's cruel and unfair first. That's what Donald Trump and Republican leaders are putting first. They have broken their promise to America. Their promise, Trump's promise on the campaign trail, was to lower costs for families. The opposite has happened. This big, horrible betrayal of a bill went through, and economists agree it's going to raise costs for family. That's breaking his promise. And it is going to have incredibly cruel and unfair treatment to immigrant families paid for by cutting our own Medicaid. It's ridiculous. We do not need more cruelty. We actually need opportunities for every family to thrive. So people need to go to familiesfirstnow.org, and it's a big, beautiful, for real beautiful uprising of people coming together to share that we're still here. And you know what else? To give each other a hug. People, I don't know about you, but like I need extra hugs right now because I do not like being put, under attack by the president and Republican leadership. We need extra hugs. So this is also a moment to give each other a hug, to be sharing our stories with one another, and to just let each other know that we're not giving up. And so familiesfirstnow.org is where you can sign up. You can sign up to host an event. You can find an event. You can attend the DC Vigil. You can do all the things. Aijen, what are your thoughts?
I think this is a day to make our own. I think we can host a little potluck at our house and get some poster board at the pharmacy and have our kids get together and make awesome signs and have our voices heard with our families and our communities, and also have some joy, have some community. And one of the things that's so important about this moment is that a lot of people don't know what is in this bill and how it's going to affect their lives. And so our job as people who are informed and are paying attention is to help the people who haven't been know what is going on and who's responsible, and then what they can do about it. And listen, I think so many people have given up, and we have to remind people that that's how more bad things happen. And this is an example of that. And we can't give up. We have to get back on the board, but we do it in a way that is in community, which is way more fun, with our families, which is also fun because we have to find activities for our kids anyway. And what a great experience for our kids to know that all of the ways that we can come together creatively to be a part of the solution and to make our country better and to stop the harm that is possible when power is in the hands of the wrong people.
100%. Familiesfirstnow.org. Sign up to host an event, find an event, attend an event, do all the things. And speaking of all the things, you are literally not alone, listeners. One of the things we see is that in polling, Donald Trump and this policy in particular are hugely unpopular. We're also seeing that there is a very loud minority of Republican leaders just saying ridiculous things, acting as if everybody agrees with them. Well, not everybody agrees with them. We can see that in polling. So this familiesfirstnow.org activation is a time when you can really be in that community and have a reality check against some of the onslaught of really bad headlines that are often not necessarily accurate. So we can have fun, we can have a reality check, maybe have some popsicles. Aijen, we have like 30 seconds left. What else can we do at familiesfirstnow.org events?
I think get together with your best friends and maybe even sign up to host your own event. And you can set it up the way that you want, play the music you want. There's so many fun family songs like We Are Family. And my favorite is A Family Affair, Sly and the Family Stone. Let's make this day about us and the strength of our families and communities when we come together.
I love it. Let's react to the disaster with hope and change. Thank you so much, Aijen Poo, for being on. Thank you for all you do.
Thank you, Kristen.
Thank you. Well, that's it for our show today. Thanks so much for tuning in as we tackle the top topics facing our nation in the way that requires the most boring disclaimer in the history of the planet Earth. Here goes. Views expressed on this show are those of the individual speakers and should not be attributed to Moms Rising, to this station, or to any news or social media service that may disseminate a recording of this show to the public or to any segment of the public. Boom! We'll catch you next week.